Well, thank you very much, Michael, for making the time to be here. We're talking about you optimize, the idea that we're all sort of work in progress, and this idea towards excellence. So we sort of have the opportunity to talk to some people who've done incredible, like sort of have been incredibly productive in their sort of different walks of life, and to get some of their insights and thoughts on this subject about what they do and how they organize their day, and a little bit about their sort of work. So Michael, please just say a little bit about what you do, and then we can talk a little bit about how you sort of adjust and make some changes to your sort of activities to be as productive and effective as you can be.
Yeah, well, thank you, Mahmoud. Thanks for the kind invitation. It's a pleasure to talk to you. Well, I'm an orthopedic spinal surgeon. I've specialized in spine well over 20 years ago, 25 years ago almost, and seen only spine patients. And I'm also board certified for pain. So I've a proper surgical training.
Yeah.
Went into pain for a couple of years, did lots of interventional procedures, injections, X-ray guided, all of them. And then went back to minimally invasive spine surgery again. Right. So I'm right in this, well, between, in this, what is very important for most patients, the step from conservative to proper surgery. So this is what I do, and I understand both areas, the conservative side and the surgical side. And I think, although I don't do major surgeries anymore, well, I think that allows me to be quite honest and to give patients a good an honest recommendation what to do, and whether that is now time to go for surgery or not.
Yeah, no, that's quite unique in that you're able to really appreciate the sort of spectrum of options available, and then sort of carefully guide them towards the best options for them. I mean, I suppose things have changed quite considerably over the time that you've been involved in this field, in terms of different techniques and recovery times and so on. I mean, is there one or two things that are particularly outstanding in this with regards to that?
Yeah, I mean, I started with I do lots of endoscopy, so this is my super subspecialization now. Right. Endoscopic disc surgeries, and right. So I've started that 18 years ago in Germany. In Germany, it's quite common. There's lots of doctors doing that. It's not that common in the UK, so I think I'm probably, well, one with the most experience. It's picking up now. There's more and more, even younger doctors who are interested to learn it. But yeah, so that is disc surgery through a keyhole, 1 centimeter incision. We normally do that even without general anesthesia. It's just sedation, which is very much liked by the patients, as you can imagine. They wake up very early. They go home the same day, and that is really something that was not available like 20 years ago, or clearly not very common.
And it's sort of the recovery is much shorter, and
is shorter as well. I mean, it depends on the individual case, what you find during surgery, but yes, it's much shorter. No hospital stay, day case normally, and yeah, that's good. So
what's the sort of time, if the patient comes to you and they got some ridiculous symptoms, or that there's some other concerns and it's maybe being progressive, how soon could you see a patient and then work them up and then take them to theatre and do an endoscopic procedure? Is there quite a gap? This is sort of privately, obviously. Is there a time interval, or?
It depends, but we have managed to do that in 1 day. Right. So a patient coming in with severe pain, almost bedridden, screaming, not able to do something, doing the MRI in the early afternoon, and then well, making a diagnosis of a big slip disc, severe radicular symptoms, and then being able to do the surgery in the evening of the same day. So that sometimes, if is possible, if the patients want that, if the hospital has availability. That's at the London clinic where I do all of my procedures, most of them in London. And but of course, this is very unique, and most patients need to think, and you may want to try injections first, or even physio. Yeah, but sometimes it's possible like that.
Okay, no, that's yeah. I mean, that's a sort of the advantage of you know, seeing somebody like yourself who has a lot of expertise and access to all the resource that you need, and you know, having it privately so they can get stuff done in real time. And the sort of typical recovery, then what does that look like? That is that sort of you know, so many sort of rehab visits or physio, or how does it go?
Yeah, most patients are eager to go to physio, but sometimes you have to slow them down a bit, because although there's only a very tiny scar on the skin, there's still some surgery, and there needs to be some healing need to happen inside. So normally we tell them, be careful for 2 weeks, and then start with physio slowly after 2-3 weeks. But of course they can go for walks already the next day. Should avoid a lot of sitting, lifting, bending, things like that.
Okay, very, very helpful. And I'm just going to ask you one more question, and then we'll just talk about Michael and how Michael does all his clever stuff. So just with osteoporosis and, you know, painful fractures and, you know, different sort of procedures that you might offer, what I mean, obviously osteoporosis is very common. The fractures may be asymptomatic, they may be very symptomatic, they may have a whole bunch of other features associated with them. What sort of things do you tend to see in your practice, and what sort of interventions do you do for patients who may have osteoporosis as a contributory factor?
Yeah, so it's of course patients with painful fractures. Quite often we send them for an MRI, because they come for acute or persisting low back pain or back pain. And we see, well, there is a fracture. And sometimes they've had a fall. Sometimes, as you know, it just happens. Coughing, sneezing. If there's osteoporosis, that could be enough. And then, of course, we, from a surgical or orthopedic point of view, what is interesting for us is to make sure the fracture is stable. It's not progressively getting to a wedge-shaped fracture that needs some intervention. If that is the case, or on the other hand, patients have a delayed healing, or for whatever reasons the fracture is not healing at all, then a so-called vertebroplasty is an option, which is basically injecting some viscous material. We call that cement, but it's some plastic. Check that like a glue into the vertebral body, and that kind of glues all these little fragments together, stabilizes the bone, and that helps greatly with the pain. Okay.
And do you tend to get any issues with the neighboring vertebra? Because, you know, sometimes we have concern that if we stabilize one, it somehow issues different loads or risk of fracture. I mean, what is your actual experience with some of these types of patients, please?
That's a good question, I think. And also, if you look at the literature, it's simply the fact that there was one fracture, which increases the risk for adjacent level fractures. I think it's not so much the stabilization, the material you inject.
Because obviously your risk goes up if you have one fracture, the risk of second goes up many-fold and so on.
And also, I mean, so I clearly explain people, well, I mean, I can only deal with the acute problem, with your acute pain, with a fracture, but you need to see someone like yourself, osteoporosis specialist, because this is even more important to treat the underlying cause of it, to do physio, to become more active, to get the proper medication. So we need to work hand in hand with that.
Yeah, absolutely. And well, thankfully, as you know, we have lots of effective sort of interventions, and we can get, you know, good improvement in the bone density. We sort of see at least 10% increase in bone density over a course of a year. You know, being very particular about having a holistic, multifaceted approach, a lot of nutrition, exercise elements to it. So it is a serious condition, osteoporosis, as you know, but thankfully we have options to diagnose early before complications. And then even if you have the condition, there are interventions, you know, to help improve the bone density and prevent fractures and so on. And with yourself, if it's sort of late stage and you've got symptoms, then interventions, surgical interventions can help in terms of control the pain and stabilize the fracture, which otherwise can have other pressure effects and so on. So I mean, I think medicine's I mean, we're pretty blessed to be doing medicine this, you know, in this day and age than say a few centuries ago. We probably wouldn't have had too many options. So so things are very very different. So just in terms of you, obviously, you know, some of this stuff is very intense and focused and serious and so on. So what sort of things do you do to be sort of you know, relaxed, rejuvenated? You know, what sort of things do you find, you know, resonate with you? And some of these things may change over time, as you know. You know, some things are more interesting or are focused at one time, and then some other times it's sort of less of a interest and something else comes to the fore. So what sort of things do you do to sort of, you know, relax and rejuvenate?
So I mean, I do have like a different job. So my medical job, what I do mostly at the London clinic, the spine clinic, that is one thing. But then I also work a lot for an American company. I'm a principal investigator for a disc nucleus replacement device. I do that for many years. This involves traveling, which I like a lot. So overseeing surgeries in other places or giving lectures, and that's that. I mean, the traveling part of that and meeting other people, other cultures, working in hospitals in South America or wherever, Eastern Europe, or so that's interesting. But and then I do a lot of Pilates and yoga.
Right.
My wife, she's an instructor, or even she's very experienced and teaches other instructors, and so I try to do that as often as possible. Should probably do more, but that helps me to stay in shape. And I think you need to be a role model for your patients as well.
They're very the patients are very discerning, aren't they? They're very perceptive. So you can't tell them give up smoking and then you're smoking away in clinic or whatever. So it's important. So with this yoga thing, how often would you do that? And is it sort of a few times a week, or is it a particular duration? What do you find most useful for you?
Yeah, most lectures are like an hour. I have to say that's a bit too long for me. I mean, I always have some other things in mind then, so that is a bit of my problem, to really slow down. So the perfect time for me would be like 30 minutes, and I try to do that like three times a week or so.
Okay, all right. And then what are the things so here, those sorts of things that are just, you know, being focused and, you know, doing your breath work and just being really aware of movement and so on can be really impactful. And relaxing and so on. So are there other sort of techniques or sort of approaches that just one or two other things that you have found over time to be really valuable for you? Is there sort of a particular other thing that you try and incorporate into your day, which really helps you, be quite aligned with your sort of most pressing and most important objectives and get more done? Because, it sometimes is helpful to have a sort of a shape or a structure to how your sort of day unfolds or your diary is for the week and so on. Are there sort of particular techniques that you have found to be helpful that you're able to share with our audience?
No, actually not really. I mean, as I said, my days look quite different. So they're not always not they're. I mean, I do a lot of I do remote consultations. Then I see patients face to face. Then it's more like
Right.
today. Then there's something different, or I don't see patients at all, and I do something else. So no.
So is the secret maybe just having this very organic, very sort of esoteric mix of things that you're doing, and it's not, you're not sort of in theater every day for every session of the week, as it were. You're mixing, and so that can in itself change is restful, as it were. So those sorts of things.
I think that's a good point. Yeah. So I could not do surgeries like every day from morning to evening. I could not do that.
Yeah, because it's quite heavy, isn't it? It's sort of quite fatiguing.
Yeah, it is. Yeah, also physically. I mean, it's demanding. Yeah, so wearing a lead gown, all the time, and so it's sometimes it's physical work. You're standing awkwardly. Of course, you try to avoid that, but you can't do that all the time. So, yeah.
So, there are sort of different times. Sometimes it's worth reflecting on what we're doing and just slightly emphasize some things and slightly do less things. And as my teams grow, and I find that I'm doing more of the things that I really enjoy rather than some of the other bits. Are there things that you feel give you the most amount of satisfaction? I know maybe it's a whole array of stuff that you really would like to do more in the next 3 months, 6 months, a year, or whatever it is. Is there something that I'm just trying to tease something out of you, so you say ooh, and then you might explore that over the next year or so? We'll have another chat in a while, and you say, oh, I'm majoring in this or something. So anything come to mind?
Yeah. No, I mean, it's a good point. You mentioned it's the fact that compared to like 15 years ago or so, I would want. I really wanted to try new surgeries, new stuff, and to do perhaps something just to have it done, or to show that you're able to do that. And now, I mean, I'm not interested in that. I mean, I could do. I only do procedures I feel 100% comfortable with, not something just for the sake of the procedure.
Yeah.
I even if I could do that and do it well, I say no. That's for someone else. I only do stuff I feel 100% comfortable. I know I can do that excellently. And that's it, because everything else is perhaps some people may need that for their ego, or to write in their website, well, I do this and this and this. No, that's what I've learned, and that helps me a lot to sleep well at night as well.
I think to have mastery, you've got to have very narrow focus, haven't you? And just appreciate that. Fantastic. Well, it's been a real privilege to speak to you, and thank you for sort of sharing the keyhole stuff and how it's sort of revolutionizing disc surgery and so on, and the fact that there are other things that can be done for pain relief in osteoporotic fractures. And then yoga. So I've been to 1 or 2 classes. I have to say I'm very limited in my sort of capabilities on yoga, but you've encouraged me to be braver and try again. And maybe I'll follow your example and just do half an hour and excuse myself. So
yeah, give it a try. Well, perhaps we can find a yoga class for men. So because that is also, I mean,
that's a good point. Yeah,
men, because it's mostly women there.
Yeah. And then you feel
you feel like lost, and you think you're the one least capable to do that, and the stiffest guy, the least flexible, and
I think we're definitely the stats in this, men usually do very badly in any medical condition, because we don't have the networks, we don't ask questions, we're a bit embarrassed, we never follow instructions. So yeah, I think that we're definitely very much in need of doing more stuff to help our health and so on. So yeah, let's explore that, or maybe we'll get your wife to guide us or something. So yeah, if we had a class for men, could be on Zoom, and just for half an hour, because our attention span's a bit limited. So
that's what I think.
yeah. Let's maybe we'll just kick this about, see what comes of it. But
Okay.
It's been really great to speak to you. Thank you again for your time.
It was a pleasure.
Have a good day.
Thank you. And you. Bye-bye. Cheers. Thank you so much.
Thank you.